Welcome, everyone. It's so good to see people here. I still see some more people streaming in, and we know with varying schedules, we anticipate that people will continue to come in. But we'll go ahead and get started. My name is Steve Luby. I'm the Faculty Director of the Stanford Center for Human and Planetary Health. I'm a proud member of both the Woods Institute and so the Doerr School of Sustainability, and a member of the School of Medicine faculty. We recognize that Stanford sits on the ancestral land of the Muwekma Ohlone tribe. This land was and continues to be of great importance to the Ohlone people. Consistent with our values of community and inclusion, we have a responsibility to acknowledge, honor, and make visible the university's relationship to Native peoples. You guys have seen the program? Well, if you have, you can see it's going to be an exciting program. We are going to have lots of good stuff to talk about today. These are important issues, and we are bringing Stanford's energy, creativity, and solution orientation to them. So we're going to talk about the updates on progress in the Center for Human and Planetary Health in our first year. We're going to showcase some research, education, and impact efforts, and we're going to highlight some upcoming opportunities. Really importantly, we're thrilled that you're here, because you're here meaning you can meet with each other and talk with each other, and so we can come together as a community and figure out what we can do as a group. And this will help to build the relationships to take on these great challenges of our time. So I want to begin by introducing Arun Majumdar. Arun is the inaugural dean of Stanford's Doerr School of Sustainability. He's a professor of mechanical engineering, of energy science and engineering, and of photoscience. He has also served in government, including in roles as the founding director of the Advanced Research Project Agency for Energy and as acting undersecretary of energy. Arun has long been a strong proponent of human health being an important part of sustainability. So over to you, Arun.
Well, I've got 50 slides to show you. No, I'm just kidding. But I just want to congratulate both the Woods Institute, I know the advisory council members are here, and to Steve Luby and your team for the Center for Human Planetary Health. This is super exciting. I know that there's a community that you have built, and the community is here, of faculty, staff, students, postdocs, and at the end of the day, it is that community, the team, that is bigger than the individual. And there has been a tremendous amount of support. Kathy, thank you very much for your engagement and support. And we are really looking forward to kind of the work that is done over here. Sustainability is a global issue. And we need to think globally. From the beginning of the school, we were both involved in the organizational structural committee of how this school should be organized. And frankly, what we had thought about is proposed, it's where we are right now. But we also talked about about how we look at this world. And one of the taglines, we actually went through some branding exercise in the school, because I think sustainability, the word sustainability, has been used or shall we say abused in certain ways. And at the end of the day, this is all about life on Earth forever. That's what this is about. And this is a global issue. And I'm so delighted to see this center come together and the support it has received, and it is continuing to receive, to make sure that our work is connected in service of life on Earth forever. Thank you very much. Yeah.
Thanks, Arun. We're now going to try recorded comments from Dean Lloyd Minor. Lloyd Minor is the Dean of the School of Medicine. He's a professor of otolaryngology, that is head and neck surgery. And he's also really been a strong supporter of human and planetary health activities, even during the time it was incubating as a pillar of the Center for Innovation in Planetary Health. So, over to Lloyd.
Good afternoon, and welcome to the third annual Celebrate Human and Planetary Health event. Thank you for engaging in this vital and meaningful work. You're a part of a wonderful community here at Stanford, spanning the School of Medicine, the Stanford Doerr School of Sustainability, and beyond. I want to thank Steve Luby, Michele Barry, and the entire leadership team at the Center for their extraordinary dedication to this work. Steve's dedication to identifying and creating impactful solutions to improve health and sustainability is an inspiration to future leaders in this field. And his effort to establish a Center for Solutions-Oriented Research has helped Stanford become a leader in human and planetary health. I'm pleased that the School of Medicine partnered with our colleagues at the Stanford Doerr School of Sustainability to launch the Stanford Center for Human and Planetary Health. Since its launch last year, the center has become the hub for transformative research and education that is being translated into meaningful, real-world impact. I'm so proud of how Stanford is responding with expanded research projects, expertise, support, and funding. Through the work of the Center for Human and Planetary Health, we're fulfilling Stanford's mission to think critically and become global citizens who believe we can make the world a better place through innovation and action. Today's event supports the innovative work of a community that is identifying and implementing real-world solutions to improve human health and the health of our planet, both in the immediate future and generations from now. This is Stanford in action. Together, we can and will make a difference. Thank you all.
So in addition to this terrific support from the deans of these two central schools, we also have a real supporter in Michele Barry. Michele is the senior dean for global health here at Stanford. She's a professor of medicine, and really she has just been very passionate about planetary health from when we first started talking about it. Created a pillar for planetary health in the Center for Innovation in Global Health and continues to support this whole effort. So, Michele, a few comments?
Now, we all know the real engine behind this is Steve Luby. So I'll start with that. And I remember really both of us, while we were in the center, realizing that TB, malaria, and HIV may be great global health problems, but actually the biggest problem in the world and that our children and grandchildren are going to face was climate and the ramifications of climate. And Steve kind of twisted Kathy and Allison and myself to host the first Planetary Health Alliance meeting in 2019, and then it was a marathon. Well, a sprint. It's going to be a marathon. But it's really hard to do global health and not recognize the fundamental threat that climate change and environmental degradation poses to health. It's clear that this is seen at the highest levels, the National Academy of Science. It's clear that it's seen at the highest levels, and it's great that Arun and Lloyd actually acknowledge it. And we'll get John Levin to acknowledge it soon, I promise. We'll work on that. And also Chris Field, whose work is just a pioneer in this area, which I had the honor of learning about recently. We're absolutely thrilled to actually hold for those of you who've been at our research convening, where you know about 200 or 300 people come and talk about global health, we're thrilled to have a joint Human and Planetary Health research convening, and that's on January 28th, and I'm told that I have to ask people to submit an abstract by October 23rd. So you still have at least a week to submit this abstract. It's going to be a lot of fun to have this combined. I also want to acknowledge the fact that Stanford Climb, which is Climate Learning Initiative in Medical Education, which is led by Barbara Ernie and Desiree LaBeaud, has really worked on bringing climate education into the medical school. There are very few medical schools that actually have incorporated climate into their medical curriculum. I've also worked very hard. I don't know if anyone's seen the website that we created called Medicine in a Changing Planet. And I see Erica Vedas, who worked very hard. She's somewhere in this room. But that is, I see her back there. That's really a website for clinicians who don't usually think about climate every day, but finding out how they can incorporate issues of climate and extreme weather into their practice of medicine. So if you haven't seen that, I think it's a great website, and it's case studies. We also continue to co-sponsor the Stanford London School Planetary Health Postdoctoral Fellowship, which that was sort of Kathy and Steve and myself sort of getting London School to put some money up at that time. Not so much money anymore, but we're working on it. It's great. We just chose 2 fabulous postdoctoral fellows for next year. One that's working on deforestation in Peru, and another working on ciguatera poisoning in the Polynesian areas. So just great fellows. Together, I just also want to acknowledge, I don't know if Jamie Hansen is here, we're also doing a science writing Advancing Planetary Health. This is called SWAP. And this is really evolving from an initiative that Allison Phillips started on Alpha, where we take actual work that our faculty does and actually put it into simple jargon, which I have to say we're not so great at doing, and then giving it to people that are solution-oriented, as Lloyd alluded to, that's Steve's really passion. So I'm going to end here with just saying I'm very happy to build on this center and continue as a partner as the years go on. And we got to do some badass stuff. So I'm going to hand it over to you, Steve.
I love that. We got to do some badass stuff. So I think it's useful when we think about planetary health to understand sort of where we sit right now as a system. So planetary boundaries represent scientists' best judgment of when perturbations remain within the range where they can come back into balance. And when we look at this rigorous assessment of planetary boundaries, it's quite sobering. You can see that climate change, we're well outside the safe operating space. We're outside of it for biosphere integrity. Think of that as biodiversity. We're outside of it for novel entities. Think of that as chemical pollution. We're outside of it for nitrogen and phosphorus flows. Think about that as too much fertilizer going in and washing into the oceans. The situation is very serious, and it has been centuries in the making. The scientific consensus here is that human actions are on track to permanently destabilize the long-standing, resilient Earth systems that the human community depends upon. This is what scientists are telling us. And so how do we feel? Well, of course, we don't just stop at the science. We go home and we look at the newspaper. We look at our social media feeds, and it's all pretty depressing and disempowering for a lot of people, but not at Stanford. At Stanford, we look at this situation and we say, oh, this is a serious situation. What are we going to do? How are we going to face this? Well, number one way we're going to face it is with our students. Stanford students are awesome. I'm just going to give you one example. One example, Liza Goldberg, as an undergraduate, writing her thesis, puts together a thesis on looking at flood exposure in Bangladesh and how this affects adolescents, published in Lancet Planetary Health in 2025. She's just finished her her 1 year of Marshall Scholarship at the London School of Hygiene and Tropical Medicine, and she's now rejoined Stanford as a first-year PhD student in Earth Systems Science. Liza's awesome, but we have scores, indeed hundreds of awesome students coming to Stanford who want to work on these important issues. Our faculty are remarkable. Last Friday, the Stanford Accelerator, particularly the Food, Agriculture, and Biological Solutions group, had an event. We had 16 faculty presentations on diverse creative ideas being supported by the Doerr School to bring transformative change to scale, targeting reducing greenhouse gas emissions by over 1 gigaton a year. It was just amazing to sit in this audience and just have one person after another stand up and say, you know, I think if we modify the genetics here, we can get these plants to fix nitrogen on their own, and then we don't need to use the Haber-Bosch process and all the nitrous oxide that's making all this nitrogen and phosphorus runoff. Just amazing. Do you know who else is amazing? Our staff. Our staff is incredible. It is our staff that runs our programs. It is our staff that puts on events. It's our staff that keeps us spending correctly and helping us to work to raise funding. They are also dedicated to this mission. And we are very fortunate as Stanford to have a mission from Jane Stanford to be a purposeful university. So I don't get depressed. I'm too busy. We've got too much to do. We've got solutions to work on to advance. That's what we're doing at Stanford. So what about this center? This new center is a Center for Human and Planetary Health, and it's really built on two legs. One within the Doerr School of Sustainability in the Woods Institute, and one in the School of Medicine in the Center for Innovation and Global Health. So we work closely because these two are immediately connected, but we aspire to reach out to all of the schools across Stanford. That's an ongoing process to benefit from this disciplinary input on the various issues that we take on. But I want to spend just a minute going back to what Michele was talking about, and even Arun mentioned it too, about why global health is so important. It's not just health that is important, it is global health that is important. And that's because if we look at the world, 84% of the world's population lives in low and middle income countries. Only 4% of the world's population is in the US. So I get it, if you like to doom scroll, you're going to hear a lot about an administration that's hostile to many of the values about investing in human and planetary health. But we should be spending 84% of our time, 84% of our reading, 84% of our projects, 84% of our research thinking about the rest of the world. We are called to get outside of our Stanford bubble and to truly think globally. But people say, yeah, but the US, it's really special. We should think about it more. After all, those high-income countries are producing so much CO2. Yeah, they are producing a lot of CO2, but if you look at it, they're actually decreasing year on year, and it's Asia and other places that are increasing CO2 production. So if we want to solve the problems of the future, let's not get too obsessed over what's going on in our bubble. Let's think about what's going on in the world and position ourselves so that we can be useful to the world. Fortunately, we have had excellent folks come forward and help us put this center together and continue to strive week in and week out so that we can continue to grow it and work to achieve our objectives. And what are those objectives? First, we are solution-oriented. We know the problems are bad. We are interested in driving solutions through providing seed funding opportunities, enabling community-engaged partnerships, and catalyzing interdisciplinary collaborations. We need to prepare future leaders. We're a university. We're here to train folks through teaching and scholarship with new educational offerings, experiential learning opportunities, career development opportunities. And with these students, and with the faculty, and with the staff, we want to accelerate impact by engaging with stakeholders. So not just keep it here in the university. And I just want to give you one example of what we're doing with students towards impact. I want to look at our HPH Action Labs. And one of the characteristics of our action labs is who signs up for these. Just look at these students. We have undergraduates, we have sustainability co-terms, we have EIPER students, PhD students, Graduate School of Business, law, DCI, engineering, communication. We have people from all of these schools coming together because they want to learn. In our educational system, we're instantiating the value of interdisciplinary communication. And so what's the kind of projects that the Action Lab does? Well, last year they did a blue food assessment in Indonesia. Jim Leap helped support that. And there's been follow-on with that. There's a lot of interest, including in 3 other provinces, requesting further work on improving school lunch programs through local seafood suppliers. Yeah, the U.S. could learn something about improving school lunch programs so that they would be nutritious and healthy too. So that other 84% can sometimes teach that little minority 4% about some things that are better. Or there was a renewable energy project in rural America that last year that reframed community discussion around health impacts and costs and has been used by other communities fighting against natural gas plant expansion. So that's just an idea of some of the things that we are doing to advance these objectives. And also, we work to build community at Stanford. That's what we're doing here. We're talking with each other. You'll hear from lots of other folks. We'll have chance to communicate. Because if we're going to take on these problems, we need to work together. So we need to engage across disciplines. We need to engage across countries. We need to engage across institutions. I work with companies that pollute. I work with polluters. If we want to decrease pollution, we're going to have to work with people who pollute. And of course, we need to work across generations. Those of us who have been at this for decades need to help support and develop people who are earlier in their journey. And I just want to call out another CIGH activity coming up in 2 days. Panel discussion on reimagining global partnerships that Desiree LaBeaud is leading. So please come and learn more about working together. So the Center for Human and Planetary Health has 4 focus areas: climate and health, pollution and health, disease ecology in a changing world, and food systems, health, and the environment. Interestingly, the Doerr School of Sustainability has flagship destinations. And I'm not saying that they copied, but let's just look at some of these flagship destinations: climate adaptation, industry, biological solutions, food and agriculture. So if you are a human and planetary health scientist and you want to know, how can I find a community that's interested in advancing this work? How can I get funding for some of this work? The Sustainability Accelerator is a great place to go. Letters of interest are due November 3rd. So, new initiatives in our first year. We are approaching the 1-year anniversary of Human and Planetary Health. And I know as you're looking at that, you're saying, wait a minute, that candle is releasing CO2. Okay, first, back up, and I want you, that's a vegan cupcake. Okay, so first off, it's a vegan cupcake. Second, we are launching a program on electrification for health. That has been initiated, and by next year, we're going to have an LED candle for the 2 years. The HPH has launched a affiliate program, and we've already had 58 faculty and senior staff sign up. And we've started a mini grant program launched so that if people need a little bit of help to get things done, that we can provide that. For education, I've mentioned the Action Lab, which I'm a huge fan of. It just will say the next one on tap right now is regenerative coffee, biochar, climate, and health. We have started an HPH graduate certificate program. And in research, we'll hear more from DECO. We've launched cornerstone projects. Project Unleaded has undergone a massive expansion, and Jenna Forsyth will talk a little bit about that. And we have 2 HPH working groups launched, one on plastics and a second on food. So, what's upcoming? Upcoming activities, well, we're at a research university, so people want to know about funding. Catalyst Awards for this quarter, make your pitch by October 22nd. The Sustainability Accelerator, I've mentioned, November 3rd. HPH Early-Career Awards, those will open in January of 2026. And the CIGH Seed Grants, which is also accepting proposals for Human and Planetary Health, will open on February 2026, and I would just underscore Michele's enthusiasm about this combined convening that we will have on January 28th. It will also be really exciting, and the cupcakes will be vegan. So, lots of ways to engage in HPH. You can join the HPH affiliate program, you can apply for funding, you can come to events, you can join working groups, you can start your own working group. So there are just all kinds of things to do. So, how do we think about where we are and how do we get to a thriving future? So the Human and Planetary Health framing highlights the links between a healthy planet and healthy people. If we want to have a healthy human future, we have to take care of the Earth. And it clarifies that humans' planet-damaging practices are not sustainable. Realizing a healthy, sustainable future is a great challenge of our time. Humans created these problems, so I think humans can work to address them. A really important part of this is to not get caught up in that doom scrolling, but rather to think about where we have agency. What are the things we can do? What are the problems we can work on where things can work to bring change? And importantly, we need to work together. And if we do, we humans can solve these problems. Thank you. Erin, over to you.
I should go here. There you go. I'll go here.
All right. Thanks, everyone. Thanks, Steve and Michele and everyone else for the really inspiring and motivating words to get us started today. So I'm here representing the Disease Ecology in a Changing World program. Remember, that was one of the 4 pillars of the HPH Center. In case you want a little color, here you go. So when we think about infectious diseases, these are some of the major threats that are cropping up because of climate change and land use change and other anthropogenic impacts on the environment. Disease ecologists like to think about this as a triangle. You need the intersection between infectious agents like pathogens, susceptible hosts like people, and environmental conditions that are conducive to transmission. And those environmental conditions are really where humans are having a major impact on these infectious diseases. At DECO, as this pillar of the HPH Center, we're really interested in kind of following through research all the way to solutions. So first, understanding the environmental drivers of infectious diseases. That's the first thing we need to do before we can really find and implement solutions. Projecting their future distributions, thinking about where these risks will be changing and where the future risks are going to be arising. And then connecting this knowledge to solutions. So this is the really innovative, exciting part of this DECO program. We have a really amazing team. I co-lead this program along with Giulio De Leo and Desiree LaBeaud, who you'll be hearing from in a few minutes, and we have some amazing other scientists and partners who have been involved in this, and we really hope to continue growing this program. We've focused for our initial 2 years of DECO on 3 cornerstone projects where we're really drilling down into systems that we think we understand the disease ecology pretty well, and we think there's important opportunities to identify stakeholder-engaged, solutions-oriented research. So first, I'll tell you a little bit about rural dengue in Costa Rica, and then Desiree will tell us about waste management and potential solutions to that in Kenya, and then Giulio will tell us more about water infrastructure and its impacts on parasitic diseases across Africa. So for those who don't know, dengue is one of the largest and fastest growing mosquito-borne disease burdens in the world. We estimate that there's around 60 to 100 million symptomatic cases of dengue every year. This is a severe febrile illness that is rapidly expanding, in part due to climate change. And that's just the tip of the iceberg. There's about 400 million estimated infections of dengue every year. So it's a huge growing problem. Right now, it's predominantly in the tropics and subtropics, but that is expanding because of climate warming. It's also transmitted by disease vectors that are invasive around the world, these mosquitoes. And canonically, this is considered an urban disease, but if you drill deeper down into the distribution of this disease in places like Costa Rica, you find that there's an underdocumented burden of disease in rural areas. In places where people are living in small communities and on farms, people have a really high incidence of dengue. And in rural communities, we think that there's some potential for ecological levers for health here, where we can understand how human impacts on the environment are shaping dengue disease risk, and in turn, how we can improve the health of the environment to also reduce the dengue burden. So we're working closely with collaborators in Costa Rica at the University of Costa Rica, the Ministry of Health, the Ministry of the Environment, the Center for High Technology. They're all really engaged in trying to better understand and, importantly, control this problem of rural dengue in Costa Rica. And we're taking a multi-pronged approach, modeling infectious disease dynamics using human case data shared by the Ministry of Health, directly sampling vectors on the ground, getting out there. I'll show you what that looks like in just a minute or two. And actually seeing where are the vectors, what types of habitats and environments are they using, and then trying to form a link between these kind of national scale case data, local scale vector data, using drone imagery and then satellite imagery to kind of map what is the habitat suitability for these vectors, where are we likely to find them, where is the risk of dengue concentrated in rural environments, and is it associated with particular land use practices like agriculture. So we've had an amazing group of stakeholders that have come together to work on this project. We had a stakeholder meeting in February where we got to go out into La Selva Biological Preserve and also talk a lot with both academic and institutional partners about what are their main priorities for this research. We also got out there and got our boots muddy a little bit. We got to actually sample the vectors and look for them in places like pineapple plantations and other types of plantation habitats, as well as rural communities. Here you can see a little bit of what that looks like. You can see we're literally vacuuming up mosquitoes off of the vegetation. This is one way that we go out and find mosquitoes in their habitat so we can figure out what environments are really promoting their breeding. Handing it off now to Desiree.
Great, thanks, Erin. It's so wonderful to be part of HPH, especially part of DECO. So, all right, everyone here knows that waste is a huge problem across the world, and there's a lot of waste mismanagement, and that puts humans at risk for diseases. There's rodent-borne diseases, and there's also vector-borne diseases that are associated with waste. And my research in vector-borne diseases have brought me very proximate to the waste crisis. We know that most of the time, the waste sits around in communities, breeding these insects and rodents, making people sick. And right now, there's a disconnect because women are really not part of the waste sector in many parts of the world. And so we know this is a huge problem. I've been working in Kenya for 20 years. My work has brought me face-to-face with waste, and we thought we'd lean on nature to figure out a solution for this because, of course, nature knows best. So we've gone to black soldier fly farming. So this is a nature-based solution where these black soldier flies actually are able to deal with compostable waste and then make incredible resources out of the waste. They take waste, which is breeding methane gases in the landfills and rodents and mosquitoes, and actually turn it into food and fertilizer, and in our case, jobs for women, because we made our black soldier fly farm completely women-led and women-run in Kenya. So this work is done with my nonprofit in Kenya, the Health and Environmental Research Institute. DECO has funded a research project for us to understand and optimize this nature-based technology for waste management. We launched our farm in January of this year. It's going well. We've done a lot of community engagement, have a lot of add-on projects supported by the Doerr School to build on the women empowerment and some of the other things that we're trying to digest with these black soldier fly farms. And we've brought Stanford students who are funded through the King Center or the Haas Center to come and work on our black soldier fly farm and work on these research projects. So we're very thankful, and off to Giulio.
Thank you. So let's see. Oh, there was.
Oh, and that's Carol,
Yes.
who leads our farm.
Very good. So I'm going to talk about water management infrastructures and the risk of schistosomiasis in Africa. Okay, so dams and irrigation systems are a pillar of human civilization. They are particularly important for the development of Africa. That is the continent that experiences the fastest growing population in the world. And yet we know that dams and irrigation systems might lead to negative effect on human health because there are so many different waterborne parasites and pathogens and water-associated vectors that proliferate in the water environment that is created through the construction of dams. So the problem is particularly strong with schistosomiasis, which is one of the most important of the so-called neglected tropical disease, which is widespread in Africa, affecting more than 250 million people, the vast majority school-age children, that require treatment on a yearly basis. And in this specific case, the vector of schistosomiasis, which is a specific type of freshwater snake, is proliferating into this environment. Now, there are a wide range of interventions that are public health intervention, environmental intervention, and engineering intervention that can decrease or eliminate the risk of schistosomiasis transmission associated to the water infrastructure, but they are systematically neglected. We look to nearly 300 environmental impact assessment of water management infrastructure in Africa, and they completely neglect it. And this is unfortunate because we know how to treat the problems, and in fact, we wanted to change the outcome by bringing this information on the table of decision maker. In order to do that, we've been working, as in the case of dengue, by understanding the driver of schistosomiasis at multiple scale, from the micro scale, working with bioengineering, Manu Prakash, and the hydrological scale with Oliver Fringers, and up to integrating the field work along with drone and satellite imagery. And in order to connect the knowledge to action, we are basically packaging all this information in a risk mapping software that we are developing with the Natural Capital Project, so that it's going to be easy for everybody to basically outline what is the risk associated with the development of specific water management infrastructure. We have just started a few months ago a really exciting project with the support of the Stanford Sustainability Accelerator, the Biology for Sustainability, where we are planning to integrate fish farming into rice agriculture for the control of schistosomiasis. We already conducted some pilot in Senegal, where we have shown that through the cycle of a rice production, we can basically fatten up and grow fish. We can decrease the number of snails, and in addition to that, we can even increase the output of rice thanks to the self-fertilization that the fish produces. So, we have an international team which included practitioner scientists for the Université Gaston Berger in Senegal, the entrepreneur like Nicolas Jouanardo, the Station d'Innovation Aquaculture, and we're working with the World Development Bank and along with the African Ministry Councils of Water in order to incorporate these fundings into the policy for the continental Africa. And with that, I think that I've terminated our slide deck, and there is a QR code for learning more of our work. So thank you very much for your attention.
Hi, everyone. I'm Kathy Burke. I am a senior advisor and lecturer for the Center for Human and Planetary Health. I co-created and teach our gateway course, Sustain 103, Human and Planetary Health. And I've been part of this effort since my former days as the Deputy Director for Global Health. I'm thrilled to introduce Project Unleaded. It's an exciting program that fits within our pollution and health focus area. It started in 2023 when Jenna Forsyth came to Stanford to work with Steve Luby as an EIPER PhD student. The program investigates lead contamination in children worldwide. It takes a holistic and systems thinking approach to eliminating exposure, and it's already had impact in Bangladesh on the ground. The program's been expanded rapidly, and Jenna has exciting news to share with us today. After Jenna's 3 minutes, we will hear from 2 working group leaders about groups HPH hosts. Each group brings together more than 100 members from within and outside Stanford, and they collectively advance work in 2 important areas: plastics and health, which will be presented by working group leader Amelia Meyer, and food systems, health, and the environment, presented by working group leader Tamiko Katsumoto. So, thank you.
All right, thanks, Kathy. Yeah, so Project Unleaded is really collaborative, and we engage faculty, staff, and students across campus. We actually started working in some sense in 2014, and we've worked across 6 different countries with many partners outside of Stanford as well. So, thanks to decades of research, actually, there's overwhelming evidence highlighting just how devastating lead is for health and development. Lead exposure results in over $1 trillion in lost productivity, millions of deaths annually. So at Project Unleaded, we actually focus on generating actionable evidence around the sources, so pinpointing the major sources of exposure, and around solution, understanding why a source causes exposure and what we can do about it. So our early work identified turmeric adulterated with lead chromate pigments as a source of exposure in Bangladesh. We worked with local collaborators in the government to intervene, and within 2 years of the intervention, we saw that the prevalence of lead-tainted turmeric decreased from 47% to 0%. That was estimated to save about 20,000 lives for less than $100 per person. So we really have been building on this, and now we have plans to significantly expand our research over the next 3 years. So sharing a little bit about that. Our first objective is to conduct additional population-level studies to identify these dominant sources of lead exposure in new countries, starting with Pakistan. And our second objective is to develop, test, and scale up interventions to address and eliminate these sources of lead poisoning. So we're broadening our spice-focused efforts and doing this across additional geographies, including India, Pakistan, and Nepal. And our recent findings in India suggest that lead chromate adulterated turmeric is being sold in about 30% of the 100 largest cities in the country, so there's still more to do there. We'll also address lead exposure from other sources, like unsafe battery recycling. Our latest study in Bangladesh suggests that children who live within 1 kilometer of these battery-related smelting sites have 50% higher blood lead levels than children living further away. So this is a really important source to think about, and this data has motivated our plans to measure and model ambient air lead pollution over time, and this can serve as a baseline for targeted interventions. We're particularly interested in interventions like catalyzing the adoption of lead-free batteries, so moving away from lead overall. Our final objective is to develop novel lead detection methods that are affordable, scalable, and suitable for low-resource settings. And we're interested in a range of applications, from contaminated spices to identifying these industrial hotspots. So please come find me afterwards to discuss if you're interested to learn more or interested in getting involved. Actually, at the event last year, we had some people come up, made some great connections, and they're part of our team now, too. So Mary's in the room. So anyway, thanks so much, and I look forward to discussing further. Yeah, thanks.
Hello. Let's see. Okay. So, as mentioned, I run the Plastic and Health Working Group alongside Dr. Desiree LaBeaud. And I wrote a little haiku to start us off. So, entering nature in infinite ways to stay. No. Plastic perish. So there's this crisis happening where plastic is all over the news right now, and microplastics can be found in every ecosystem. Unfortunately, they're found in nearly every human organ. They can also act as a way to transport pathogens, pesticides, heavy metals in the environment. They're found in soil, water, and air. They can also impact our inflammation, impact babies, impact elderly, and our brain function as well, as finding that microplastics impact like essential systems for the earth, including photosynthesis, nitrogen cycle, carbon sequestration. So that's horrible, and what can we do? A great way to find like-minded people, connect with people in every school from Stanford alongside external bodies. We have people who engage with policy work in California, policy work at the international level. We've had leading plastic authors come in, people who work on art, and also just students who are very interested and passionate about doing research involving plastics. So please join us at our interdisciplinary Plastic and Health Working Group. We meet monthly, and we have different themes and different guest speakers that come in and discuss plastic at different angles, where we really are trying to do something about it in this solutions-oriented work and how to address it through writing grants together. We're working on papers, as well as organizing field trips, and we hope to be a part of a citizen science work that's happening in Monterey Bay, where we might help collect samples this fall and /winter. So yeah, we'd love for you to join. Please use the QR code and reach out to join our working group.
Great, thank you so much. First, I just want to thank Steve Luby, Allison Phillips, and Sara Damore, who have been incredibly supportive of our food working group. So thank you a million for that. Sorry, how do I do this? So my name's Tomiko Katsumoto. I am a rheumatologist clinically. I am a subscriber to Food is Medicine, and for both Human and Planetary Health. And I'm so sorry that my co-leads today, Christopher Gardner and Natalie Lambrecht, couldn't be here. They are both so important. They were traveling. Christopher Gardner is of Netflix fame. You probably saw You Are What You Eat. He's a world-famous nutrition scientist. Natalie Lambrecht, she publishes with Johan Rockström of the Planetary Boundaries. She's incredible, postdoc here. So anyways, I'm really honored to be here to represent this working group. And so what I'd like to share with you, I think we're all here today because we share a common understanding of the planetary threats that we are facing. And I think we recognize food is a huge part of the problem, but food is a really critical part of the solution. And as such, our goal is to convene a group of like-minded folks to really focus on, healthy people and a healthy planet, transforming our food systems to really create a healthier, more sustainable world. Our vision is we want to foster collaboration, really generate a lot of great research ideas and collaborations. We want to, network. We want to generate a knowledge. We also want to drive impact, thinking about communicating outwardly, really influencing and getting people to change their behaviors, shifting their diets, things like that. We're very fortunate. We now have over 130 members, and we have representation across almost all six schools. Education's the only one we're missing, but all the other folks, engineering and humanities, law, medicine, sustainability, they're all represented in our group. We've got folks from, also external institutions, companies, et cetera, private, government, and we have a bunch of researchers. We've got a bunch of community folks. We even have podcasters in our group. It's been really, really fun. So just to give you an example, a little flavor of what we've been up to. We're a relatively new working group. We actually just launched in April. And so for our first sessions, we started with sort of a brainstorming session, really generating, kind of understanding what people want to do more of, what they want to focus on. We had some really exciting lightning talks. We're going to be doing more of that, where we've had people from the community, people from various different research areas and community-based places give a pitch about what they're doing. Some really exciting guest lectures. Christopher Gardner gave a really great opening talk on health science communication, about plant-based diets, and of course he's an incredibly engaging, compelling speaker. We had an exciting meeting with Amelia and Desiree's group. So the plastics and the food working group came together because plastics are in our food. So this is an incredibly important problem that we want to tackle together collaboratively. So just a pitch for our QR code, please join us. We've got some exciting upcoming sessions. October 21st, Debbie Sivas is an environmental lawyer. She's doing some incredible work on CAFOs, the concentrated animal feeding operations. She's trying to look at subsidies and how that drives our food choices, a lot of it involving animal agriculture. November 18th, we're gonna have a very exciting science communication panel. We have Zoe Science and Nutrition and Viva Longevity in the house. It's gonna be a really dynamic discussion. I think we need to figure out how to also communicate outward, influence to help drive behavioral changes. And finally, we've got Lisa Goldman-Rosas coming in December. She's doing some incredible research on community engagement. So lots of cool stuff on tap. Really excited to lead this, honored to lead this, and please join us. Looking forward to seeing you all.
Hi, everyone. I'm Allison Phillips. I'm the managing director for our center. I send a lot of emails. Has anyone received any of the? Yeah, I send a biweekly newsletter and other outreach. So it's just so nice to see everyone together. It's so nice to see your faces. Thank you all for coming. This is an incredible community. I believe that we have the brightest minds and the biggest hearts and the strongest commitment to impact that I've seen on this campus. So thank you all for your work. I'm going to give you 2 minutes to stretch, to talk to your neighbor, to say what brought you here today. And if you're really fast, you can grab some decaf coffee or some lemonade in the back. 2 minutes. Okay, go. Okay, so now we're going to move into the part of the program where we have lightning talks. So this year, we decided to open up a request for applications for lightning talks to see who would come forward. We were really hoping that a lot of students would come forward, and they did. It was so exciting to see all the amazing efforts that are happening around campus. So we received a lot of applications, and we have 7 lightning talks. 6 students and 1 faculty who has the energy of a student. That's Desiree, if you couldn't tell. And the talks will be back to back, and each presenter will introduce themselves. So please just, as an audience, do a great job of applauding for them after their talk, and then they'll just come back to back. So I'm excited to introduce Aly Singleton. Aly, if you want to come forward. Aly is an amazing... applause at the beginning is really welcome, too. Thank you. I love this. So Aly Singleton is an amazing PhD student with the EIPER program. Over to you.
Hi, it's locked. Can I click this? Yep, okay. Hi everyone, my name is Aly Singleton. I'm a 5th-year PhD candidate in the EIPR program. I'm co-advised by Steve Luby and Erin Mordecai, both of whom you heard from just now. I'm going to tell you a tiny bit today about my work studying the impacts of highway construction on dengue transmission. Dengue is a vector-borne disease, as Erin described earlier, so it's transmitted by a mosquito. And this work started as a case study studying the impact of the interoceanic highway on dengue transmission in Madre de Dios, Peru, which you can see in the map. And we found really striking effects of this highway being paved on dengue transmission, with an over 400% increase in dengue transmission post-paving compared to dengue rates before the highway was constructed. And the two hypothesized mechanisms for why this is happening is that first, vectors, so mosquitoes, are able to disperse along the highway corridor, likely facilitated by highway construction and hitching rides in trucks and breeding in construction equipment and construction sites. And then also that the highway facilitates more human movement throughout the region. So as humans are able to travel more easily throughout the region, the virus can circulate more quickly and be imported from neighboring regions that were previously unconnected. But our question was, does this generalize to other parts of the Amazon? This is just one part of the Amazon. The Amazon is a very, very large area. So I'm now working on a follow-up project studying this phenomenon across the entirety of the Brazilian Amazon from 2000 to 2024. You can see on the left paved highways as of 2024 in pink, unpaved major roads in gray, navigable waterways in blue, and each of those points is a healthcare facility that reports dengue cases at a monthly or even daily timescale. And you can see on the right side the panel of highway data that I constructed that shows the highway network expanding over time, with each photo showing you the pink is the new highway that was paved or constructed in that year. So what we're going to do is we're going to compare, as those highways go in, do we see dengue increase in the health facilities that are near to those highways? And what we find is we do find that this effect is generalizable across the board, but it varies somewhat. So what you're seeing here is I'm comparing dengue transmission in communities that are close to highways versus communities that are far from highways. And you can see on the left side of the graph that prior to highway paving, there's really no difference in those communities. And as soon as a highway goes in, we see dengue transmission increase in communities that are near to new highway paving projects. And that effect is also sustained across time. These effects do vary based on dengue burden prior to paving. So if you're low or high burden prior to paving, you see different sizes of impacts. And also we see different impacts based on highway location and size, which makes us think that we can intervene and predict what highways will have large impacts versus what highways will have small impacts, helping us to contribute to development decisions. How can we develop sustainably while considering economic, environmental, and health impacts? Thank you.
All right. Hello, my name is Ashley Argosa, and I'm an undergraduate at Stanford studying computer science, and I'm here with Radio Club and SEP. Let me see how I could go to the next slide. Okay, great. So to talk a little bit about this project, essentially we know we're all on the same page that climate change is a problem and that we're having more frequent, more intense wildfires. But what can we actually do about this? We know that frontline communities are most impacted by wildfires. We know that those who are disabled have the most severe reactions to things like smoke. We know that Native communities are reliant on the land that is damaged in wildfires. And we also know that these communities who may not be able to afford to evacuate or cannot afford the damages to their properties may not be able to cope with these changes in environment. So what are we doing about it? We know that current industry for off-the-shelf products that are smoke sensors for controlled burns just aren't adequate. We know that as of right now, a lot of them are very expensive. We know that they require power to wall outlets. We know they require Wi-Fi connection. These are just not suitable for deployment into national parks and forests where we're actually doing these controlled burns. So in partnership between Radio Club and SEP, we've created the project SMESH, where we have created these nodes that are able to be deployed easily. They're low cost, lightweight, and cheap to make. in terms of all the sensors that are on board and can be deployed around a controlled burn. And so you could even see in some of the images, some of the nodes, these are equipped with temperature, humidity sensors, wind sensor, and you could even see on the right-hand side the 3D printed structure that is used for this. This is a wind vane completely made on campus, Lab 64. It's incredibly cost efficient, and this is in partnership with UCAR. And so as a result, we can see equivalent results to what you may pay hundreds of dollars for in a product like this that is easy to go out into the forest with. We've already deployed at areas like Pepperwood, Jasper Ridge, The Dish, Henry Coe, and more, and we plan on doing even more this year. And so this will truly shape the future of what controlled burns will look like, and having data-driven results such that we can motivate additional controlled burns as California expands the number that will occur in the next decade. Thank you so much.
Hi, everybody. So I'm here to not talk to you about research, but actually to get everyone in the room involved in CLIME. So what is CLIME, you ask? CLIME is the Climate Learning Initiative in Medical Education. Michele Barry already brought this up during her opening remarks. We all know, I'm a practicing physician, and I know that either indirectly or directly, all of the patients I see are suffering the human health impacts of climate change. And unfortunately, some of our most trusted providers and our most trusted influencers in our worlds for medical education, our physicians and nurses and physician assistants, are not formally trained in climate and how it impacts human health. And so what we are trying to do here at Stanford is to take a very strategic and holistic approach to integrating climate medical education across both undergraduate and graduate medical education. So you can see our vision is to equip every Stanford-trained physician with the skills to address health and equity impacts of climate change and practice sustainable healthcare. And as I mentioned, what we're doing is integrating climate curriculum and just ways of thinking into all of medical education. We're working on curricular development, we're doing faculty leadership, we have a ton of students that are interested in this and that are working with us to both develop and execute on our projects. We work with a lot of external collaborators who are trying to integrate climate change into their medical education at their different universities. We are going for competencies and medical standards and integrating into board exams so that we know that people will be forced to integrate climate into their curricula. And then finally, we're doing some research and publishing in this area. So if any of this is of interest to you, I hope it is. We are very open to you joining CLIME. There are some CLIME members in the group. We've got Tommy Coe and Lauren in the back, and I'm sure others. So please find one of us at the break and join us in this very important effort. Thank you.
Hi everyone, my name is Alexandra Kwan and I'm a co-terminal student at the Sustainability Science and Practice program at the Doerr School of Sustainability. I'm here with the privilege of talking to you all about Climate Week, which is happening just this Sunday. As some of you may know, our first ever Climate Week was just last spring, so very quick turnaround, but it has been a tireless and very passionate effort from our team to create this annual tradition, so it's here to stay. And so this year's Climate Week is really about reframing the vision of what Climate Week means and is perceived by people. So when you hear Climate Week, you probably think of policy, energy, technology, but really this week is about building something bigger. It's about every field, every discipline, every person coming together to redefine and reimagine solutions that work across systems. So from finance to healthcare, from labs to boardrooms. And now I realize I should have figured out how to change the slide beforehand. Is it this controller? Got it. Thank you. And so I'm happy to announce that we're hosting 2 healthcare events, one next Tuesday evening and one next Thursday evening. So the first one is Healing Without Harm. We'll be bringing together a panel full of surgeons, sustainable hospital leads, innovators working to explore how the healthcare system can reduce resource use across operating systems and rooms, across procurement and infrastructure. And so we'll be exploring strategies on what this looks like. So a healthcare system with low carbon but high quality without compromising on patient outcomes. And then our second event is on public-private partnerships in global health and climate investing. And so this panel is looking beyond the Bay Area, beyond Stanford, we're bringing in leaders from across the capital stack to talk about how can we align incentives, how can we bring together and sequence philanthropic capital, concessional capital, and private capital to de-risk investments, and then as well as enable local ownership. And so we'll be looking into questions such as governance stability, catalytic capital, and local community accountability. And so this is really the vision for Climate Week. There's going to be more than 50 events, from arts to storytelling, from science and research, to bring together and reimagine what it means when every field is sitting at the table. And so we welcome everyone from economists, students, engineers, doctors to come together and just connect, to lead, and to experiment with us. Thank you.
Long walk. I just learned my watch has a timer. So no Oscar music for me. Hello, my name is Ben. In April of 2020, I was a junior in college at Brown University, and I was one of every college student who was sent home due to the pandemic, and one of many who probably saw story after story about food piling up on farms and food banks facing the longest lines they'd ever seen. And at the time, I decided to start calling farmers that we were reading about with my brother, several friends from Brown, and actually many students from Stanford. We called 200 farmers before finally getting through to an onion farmer that had just been written about in the New York Times. He had a pile of 6 million pounds of onions that he was digging a ditch to bury. And he said, if you get a truck here, you can take whatever you can. So we did. We paid a truck driver to go and pick up 40,000 pounds of onions that he brought back to a local food bank, and then reached out to every student we could, and within 2 months had 200 college students around the country doing the exact same thing. In that first year, we recovered 20 million pounds of surplus produce from farms and distribution centers, upstream in the food supply chain before it gets to grocery stores and to restaurants. We learned there is a huge amount of surplus that goes to waste every year, and it actually was only exacerbated by the pandemic. So after graduating, I started working on this full-time, and over the last 5.5 years have built the FarmLink project with an amazing team of now 30 employees and over 700 students, and we've rescued almost 500 million pounds of food. And the FarmLink project still goes on today. I'm very happily settling into student life once again. I had my first accounting quiz yesterday. It went horribly, and that's fine. But I have about 1.5 minutes left. I would love to, well, I have a minute left. I'd love to invite anyone here who is interested in learning more about FarmLink to come and find me. FarmLink is still very much at the beginning of its journey. The charitable food system in our country is fragmented, and it has so much potential to go so much further than it currently does. There are 47 million Americans who are food insecure. That is almost double what it was before the pandemic. And that number has grown steadily in the years that have followed as support systems that were put in place during the pandemic are slowly and increasingly rapidly being removed. And yet I have huge hope that FarmLink and the organizations we work with are capable of doing a hell of a lot more than has historically been done, especially where it comes to fresh produce. I'll share in my last 20 seconds, I remain super passionate about this space beyond continuing to support FarmLink, and I'm currently learning everything I can about how we can be exploring crop discovery and how we can accelerate the agricultural learning cycle in similar ways that are currently being done with foundational models for materials discovery and drug discovery. And if any of you are interested in talking about that or directing me towards people who can help me learn, I would love to learn from you. So thank you for your time.
Hi, everyone. My name is Yingjie Li. I'm currently a postdoc with the Natural Capital Project. So our team actually focuses on investigating nature's benefits to people. Okay. So unfortunately, as you can see from these 4 pictures, there's very few or very little nature in the urban settings due to growing population in the urban area and also huge demands for housing and transportation and a lot of other stuffs. And based on some clinical studies, they found not only those kind of urban living linked to some physical health, such as respiratory health issues, but also mental health issues, because people are sitting all day and have barely opportunity to interact with nature and for recreation or social connections. So recently we did a meta-analysis, a global synthesis of more than 80 studies, field-based studies, and cover more than 6,000 population in the study. And we found nature exposure actually can substantially increase people's mental health. As you can see, it's not only can reduce those kind of negative outcomes such as anxiety, depression, but also can improve those kind of positive outcomes such as restorative effects and also vigor. So the key message from our study is that nature in the urban settings really matters. Even 15 minutes in contact with nature can help boost your mental health well-being. So build on this global synthesis study and also some pilot studies in London and Pittsburgh, working with our in-house psychologists and sitting there, and we draw those kind of evidence and put into the evidence and parameters into our widely used INVEST model. The goal is to evaluate other co-benefits of urban nature, for example, recreation and air pollution reduction and climate regulation and water retention and flood mitigation, all those kind of different benefits of urban nature. And also we work with urban planners and city agencies to come up with a range of different land use and land cover or land use scenarios, and to see which kind of land use planning scenario can maximize those kind of benefits. And we, based on those kind of optimization, the final goal is to come out with the ideal plan that can maximize those kind of benefits and achieve multiple sustainable development goals and to inform urban planning strategies. Thank you.
Hello. Firstly, I just want to say everyone so far in the lightning talks has been incredible, and yeah, just a big round of applause for them. No pressure to finish off. But yeah, my name's Raina. I'm a master's student in bioengineering, and I'm here to talk to you about research I did with the Mordecai lab last year on how climate and land use change affects leptospirosis in Brazil. Now let's back up. How does this work? Okay, green? Yes. You're wondering what leptospirosis is. That's okay. I didn't know what it was a while ago either. But leptospirosis is a bacterial disease that infects both animals and humans and approximately causes 55,000 cases in Brazil every year. It's one of those neglected tropical diseases that we don't really talk about. And it primarily spreads when an infected animal comes into contact with a human. The most common way is they contaminate water with their urine and it spreads. Flooding increases that risk because the contaminated water sweeps into homes and streets. Temperature is critical for these bacteria to survive. And farming and livestock, well, you naturally spend more time with animals than you would otherwise. So we knew all of this. What we didn't quite know is how all of these factors matter, which of them matter the most, are there others that matter too? So, because we're at Stanford, I decided what better way than to use machine learning to answer these questions. I modeled leptospirosis occurrence across all of Brazil from 2007 to 2023 using an algorithm called extreme gradient boosting, or XGBoost. And first, I made sure the model actually performed well, because if it doesn't, this whole thing's a moot point. But it did, so that's good. And then, so then I wanted to find out which variable contributes the most to leptospirosis in Brazil for this time period. It was actually urbanization. Now, this wasn't really in the results we were expecting. We thought it would be temperature or rainfall, but this would make sense, right? Firstly, you need people for the disease to infect people. Additionally, leptospirosis would infect more people if they're in a really densely populated area and only have a couple of water sources to access. But this is the first time we've been able to confirm this pattern systematically on a national scale, which is pretty cool. And then because I already had a model going, I was like, all right, what if we had kept Brazil's urban areas the same as it was in 2007 and made everything else stay the same? So that's what we did with counterfactual analysis. And red is basically the regions where Brazil's leptospirosis outbreaks would have been lesser during this time. And yeah, we see that urbanization has had an impact throughout all of Brazil to some extent. And this is especially true in places where there's been rapid, unplanned urbanization. Because the reality is, we need to understand how human development impacts these natural processes and accelerates them to deleterious effects and to our detriment. So, to protect human and planetary health, I think that's what this is about. We should probably look into that. Thank you so much.
Hey everyone, I'm Sara Damore, and I'm the program manager at the Center for Human and Planetary Health, and I'm really excited to present our next two speaker groups to you. First, we're going to hear from our Early Career Award winners, and then we're going to hear from Gordon Bloom and Sarah Singer. You may know them as a power duo, and they teach a course on human and planetary health leaders. A little bit about our Early Career Awards program. It's one of our flagship programs. It supports early-stage career faculty working on interdisciplinary solutions-oriented research in human and planetary health. We run this program in conjunction with the Woods EVP program. Since its conception in 2022, we've supported 7 awardees, and if you want to be the next awardee, we're opening up our next round in January. We're going to hear from our last 2 winners today, which is Jade Benjamin-Chung for her work on antimicrobial resistance, and then Yuan Wang for his work on biogenic emissions. And with that, I will welcome Jade.
Hello, really grateful to have funding to do this project I'm going to tell you about here. Antimicrobial resistance is a planetary health threat because it threatens our ability to treat common infections in both animals and humans. And it actually is estimated to cause over 5 million deaths per year, which is a much larger number than the total number of deaths from malaria and HIV combined. The common lore, sort of in past research focused on AMR, has really looked at clinical and kind of healthcare settings predominantly. How did I come to this question? Well, I'm doing an ongoing trial in rural Bangladesh on a completely different question. But we said, let's just take a look at whether or not these infants are colonized with AMR bacteria. We found that 93% of 6-month-olds were colonized with multi-drug resistant bacteria. My colleague who used to work with Steve Luby here at Stanford, who's now at CDC, said, oh, by the way, we're doing a study in rural Bangladesh where we found that 75% of mothers who just delivered at home are colonized with multi-drug resistant bacteria, 50% of them with carbapenem resistant bacteria, which are kind of the nightmare bacteria that can not be treated necessarily with last resort antibiotics. So what's going on here? How is this possible? How are we seeing this in these rural community settings where, by the way, many of them are not accessing care very frequently and have not been hospitalized recently? So let's see if this pointer works. Many of them are living in rural household settings where their home is unimproved. They're living on a home with a soil floor. And that's actually the topic of this other ongoing trial that we're building on in this study. They also are living in very close connection with animals. So they have chickens, for example, that are roaming in and outside of the home. They're a really important part of the household's nutrition and also sometimes a source of income. We found in this kind of smaller pilot study we did that the number of chickens owned was strongly correlated with the level of antimicrobial resistant bacteria that we found on the soil floors. We found this for all animals that we looked at, but the strongest correlation was for chickens. So that's what inspired this question. What we're really interested in, if we specifically focus on the perinatal period with pregnant mothers and infants, and how they could possibly become colonized so early in life. Is there something going on related to the unimproved living conditions, the presence of these animals so close by, and sort of unregulated antibiotic use in these populations? So we're building on a ongoing randomized trial in rural Bangladesh, and this is a trial where we enrolled households with soil floors, and half of them randomly were selected to receive a concrete floor. It's a lot easier to clean a concrete floor than a soil floor. You can actually fully remove animal feces from a smooth finished surface like this. We're adding, with this additional funding, we're adding a variety of sample types, and we're looking at multiple kinds of outcomes related to antimicrobial resistance, including those sort of nightmare bacteria, as well as molecular markers for types of E. coli that are associated with antimicrobial resistant urinary tract infections. This is a One Health study, so we're looking at humans, we're looking at animals, and we're looking specifically at different types of environmental samples within the home. And we're hoping to generate data to help us develop interventions in the future to try to bring down the burden of AMR in these settings. Thank you.
All right. Hello, everyone. My name is Yuan Wang. I'm assistant professor in the Earth System Science Department. And I'm truly honored and humbled to get this award. And I want to acknowledge the contribution from my postdoc, Yuan, and my collaborator, Sam. All right. So we all know that ozone and PM 2.5 are the leading air pollutant in the air, which can kill millions of people every year. Traditionally, we pay a lot of attention on anthropogenic emissions, human activities, but actually, in fact, the trees, grass, sedge, they can emit a lot of biogenic volatile organic compound, BVOC, such as isoprene, monoterpenes. They are largely overlooked in the health assessment. And according to our calculation, in an urban setup where most people live in, the biogenic contribution can contribute up to like 50% of the city ozone levels. And in our recent study, we found something more interesting. Like in the very hot days, these organic particles, they can highly reactive and form something we call ultrafine particles through the chemical reactions. And those particles, they are much smaller than PM 2.5 we're talking about normally, and they can penetrate deeper into our respiration system, and their health effect is still largely unknown. And what really makes things even worse is global warming, because biogenic emission is a function of the temperature and actually increase exponentially as a function of temperature. And we know the anthropogenic emission will go down eventually, so what's the role of the biogenic emissions can be more important. And in this integrated framework we propose, we first try to correct the biogenic emissions because we found the mechanical emission mechanism used in most of the modeling framework is not good enough to capture the nonlinear relationship, so we want to replace them using a machine learning-based framework with top-down constraint from the satellite measurements. And in the second step, we're going to use air pollution chemical transport model with adjoint capability, which means we can pinpoint exactly which emission source contribute how much air pollutant, like ozone, PM 2.5. And finally, we will combine our pollution data with the neighborhood health data, really try to understand the health impact of the biogenic emission and related PM particulate matter, etc. And please don't take us wrong. We do need more trees, but we just need to smartly choose what type of tree we want to plant in our urban settings. Thank you.
Sorry about that. Better? I'm Sarah. This is Gordon. We're here to talk about our Sustainable Societies Lab, so let me actually advance this. This is going to continue on the theme of the amazing students on campus and also build on some of the educational offerings around human and planetary health. So the Sustainable Societies Lab is the embodiment of the vision of a number of students who came to us and said, we are looking for opportunities to more deeply kind of engage with these issues, to think and to discuss human and planetary health. And so the Sustainable Societies Lab was born to sort of be a series of courses on campus. The first one I'll talk about is Global Leaders and Innovators in Human and Planetary Health. And I hope that there are a number of our students in the class, in the audience today. Can you kind of raise hand? So thank you for coming. We felt so this was when our class should be meeting. We felt it was really important for them to get to see all of the things that go on around human and planetary health on campus, so we combine our efforts here. But what we do in that class, we call it kind of co-created with students. We invite guests to come to be in conversation with them about what it is that they're doing in order to inspire the students to think about ways that they might do it themselves. And part of what we do that I think is unique is that in the process of discussion with the various guests who come to speak with us, we build our own theory around what sort of leadership and innovation is required for doing what they're doing. So I share with you just the first couple that we derive from the first few speakers that we had this year. First says that, highlights the way that self-care is really a kind of secret to being able to sustain people's innovation. We heard from the leader of Embrace to kind of derive that insight. The second one, our students haven't even kind of seen the output of, but all of their feedback about a group called Sipali, who we recently heard from, led us to understand that there can be mutually reinforcing virtuous cycles that occur if organizations go into different sites using endemic resources, giving the people there the opportunity to have new economic opportunity that enhances the situation of the families. They gain the benefits, the community gains the benefits that allow them to reinvest in a way that, that improves things. So each time some new guest comes, we learn and develop new theory that could inspire the people in the classroom. And we turn then back over to our students to say, how is it that you are leading and innovating around human and planetary health? And to sort of share just one example, we invited Joseph Garcia from the Solar Car team, who's in the class, to tell us about it.
Hey, how's it going? So Sarah and Gordon do a lot of great things. Something else they do is they're advisors to the Solar Car team. Solar racing has been around since the 80s as a sort of a challenge and an engineering challenge and a demonstration of the technology for solar power and what it can do for transportation. Stanford got involved in 1989. We've had immense success. Just recently, we placed second in a race representing teams from all over North America. And we've built over a dozen cars. The purpose, like I mentioned, demonstrate where the technology is currently, but the byproduct is much bigger than that. We're training generations of engineers who are interested in sustainability and have that focus, but also have the experience and the tools to tackle those problems so they can turn around and actually make an impact. We're about the students, Sarah and Gordon about sustainability, and together we make a good partnership. Thank you.
How many students on the team is here?
We have around 30 to 40 core members, and we're growing very rapidly. We've recovered a lot since COVID. The growth has been exponential, which is great.
Still welcoming people?
Yeah, we're still welcoming people of all experiences. When I joined, I joined as a freshman, had zero engineering experience. Now I'm one of the leads. Jason is also part of the team. Yeah, come join us.
Thanks. So thanks, Joe. A couple things I'll say about that with the Stanford Solar Car project. So we put together a class together with one of the co-founders of Tesla, Mark Tarpening, and invited the Stanford Solar Car team to partner together to do that. It was a great class, and that's been a source of interesting sort of interactions and collaboration. That's part of the ideal. Joe did mention that the Stanford Solar Car team really was in a low period. COVID hit the team hard, and then they rebuilt, and while they had a complete wipeout 1 year ago in their national competition, this year they placed second out of 34 university teams in the national competition. So bravo to the Stanford Solar Car project. I'm just going to say a couple words quickly about another course that Sarah and I have created together with our students called another Sustainable Societies Lab, focused on models of Israeli-Arab cooperation and pathways to peace.
This course grew out of a Bing Overseas Studies program that Sara and I created called Exploring Israel's Innovation Ecosystem, Sustaining Human and Planetary Health. And that was in 2022. And we came back with our students and they requested specifically that we create this Sustainable Societies Lab. And then the war broke out in the Middle East, and we have since not been able to take our students to Israel in order to continue the work that we've been doing in country. But we've pivoted a little bit to have a robust series of things going on campus. And an example of the course that we created for last year, we had 15 people from the Middle East, political leaders, experts in New York and Washington, who'd Zoom in, and we had 12 faculty members from Stanford who partnered together to do this new course. One of the organizations is EcoPeace Middle East. We had the Israeli and the Palestinian co-directors of EcoPeace Middle East working on a project together with our students, the blue-green deal, where there's a trade for desalinated water and renewable energy between Israel, Jordan, and Palestine. So we're continuing that work, and now with the newest developments in the Middle East, we hope that that creates an opportunity for our students to be able to provide participation in models of this cooperation and pathways to peace.
I'm Chris Field, the director of the Woods Institute, one of the hosts of the Center for Human and Planetary Health, and I get the distinct privilege of closing out today's session and congratulating a group of incredibly sophisticated and inspiring speakers. We've heard about everything from climate education in medical schools to air pollution in trees, and the breadth of topics and the passion and intensity that people bring to those topics really underscores why this topic is so important and how much opportunity there is. Now, I don't want to add another dimension to this, but I do want to close by congratulating the founders of the Center for Human and Planetary Health, for whom it has been a long and sometimes frustrating journey. So to Steve and Allison and Michele and Desiree, Giulio, Erin, all of you, it's remarkable to see the program get to the place it's gotten now. And it really is heartwarming to see the progress and the coming together of just a spectacular community. And let me just close with the thought that there is no topic in sustainability that's more central to get right than the link between planetary health and human health, and their opportunities for a way bigger community than this. Stanford has taken unique and impactful steps to build a bridge between the medical school and the School of Sustainability, but that bridge needs to be something on which many more people stand, and a bridge that serves as an aggregator for a community that's going to change the world. So congratulations, and I can't wait to see what happens next with the Stanford Center for Human and Planetary Health.
Thanks, Chris. And thanks, everybody. You know, we're all busy. Every minute is overscheduled, more emails than we have time to. Look around. We have over 120 people in the room who wanted to spend time to learn more about human and planetary health, who wanted to meet others thinking about human and planetary health, and wanted to come and talk about it. So thanks for giving your time and joining us today. I want to thank the presenters for making this such an engaging event. Your talks were awesome. I want to thank the HPH leadership team who've really driven and supported these activities, like Chris was saying, not just in the last year, but for over the course of the last 8 years. I want to particularly call out Allison Phillips, our managing director, Kathy Burke, Doug Rosales, Sara Damore, Erica Vedas, and Katie Vogelheim for their contributions in bringing this event together. I want to thank Arun Majumdar, Chris Field, Lloyd Minor, and Michele Barry for their support. And so let's now take the opportunity to eat some good food and to continue our conversation and to enjoy some. Oh, do you know why it's good food? Because it's sustainable food. We've got sustainable food and drinks. Thanks all.